Defend Our Democracy will this morning protest to demand the reopening of Charlotte Maxeke Johannesburg Academic Hospital. According to health staff, the increased patient load has put considerable strain on Helen Joseph Hospital. Joining us now to discuss the protest is Defend Our Democracy Convenor, Dr. Fazel Randera. Dr. Randera, very good morning to you. Thank you so much for joining us on Newzroom Afrika. You want people to gather at Gate 6 from around 11 o'clock this morning. What is the plan?
Ma'am, good morning to you and to your listeners, and thank you very much for having us on a Sunday morning. Tomorrow, of course, the Gauteng Premier will be giving his provincial State of the Nation address. Our feeling is that, this hospital that has been closed for the past, well, not completely closed, but has not been functioning at full capacity for the past 10 months, there are lots of questions that we need to be answered. Patients are suffering, health workers are not being able to do their work, and other hospitals in the area are being put on strain.
So as a group of people take to protesting, going out with placards, what messages do you want to convey, especially when it comes to the demands and timeframes?
Well, the messages that we want to put across very strongly and clearly is that, one, of course, let's fix and open this hospital as quickly as possible. We were told in the news conference the other day that we're looking now at some time in 2023 to finish this. Already, since the fire started, it's been 10 months. So we're looking at a long period of time before this hospital can be opened completely. The cancer unit, we are told, is now functioning, but casualty is still closed. Several other departments are now closed. Nurses and patients can't park their cars, so there's a safety factor that comes into play. And of course, we've now heard once again that several officials in the Department of Infrastructure Development in Gauteng have been put on suspension. What is that all about? I mean, why is there not greater accountability on a matter that is about life and death? Because that's what hospital, a quaternary hospital like Charlotte Maxeke, that's what it does. It's about saving people's lives and providing care. And yet we are not being given all the information that is necessary.
As you make mention of those people who...
I'm sorry, I really cannot hear you, very faint.
Okay, I'm going to try speak up. This week, we know that the Gauteng Health Department attributed those delays to corruption. You mentioned elements of perhaps the repercussions of the corruption. Is this enough for you, for you to perhaps, look at a different time period, or are you simply saying it's not good enough and you want that hospital fully reopened?
We're saying this is just not good enough. We're given pieces of information. We know that it's due to the involvement of the SIU that we even got that information as such about people being suspended. Why is it that when Gauteng actually, with the debacle and the negative publicity that Gauteng province received around PPE, the expenditure and the waste of money that took place around PPE, why is it that we are still in 2022 with all the information that is being given to us by the Zondo Commission as well as by the SIU, why are we not able to get on top of this matter of corruption in our departments? It is really sad that continues to bedevil us, and the result is that patients are being inconvenienced. We still don't know how many lives are being lost as a result of this hospital being closed. We know from articles in newspapers and comments made by doctors in other hospitals, the strain that is being put on other hospitals. So this is just not good enough. And we want greater transparency, we want greater accountability, and of course, we want the hospital to be opened as soon as possible.
You say that patients are inconvenienced, patients are suffering, and health workers themselves are not able to do their jobs. Exactly how deep is the extent of patients suffering and being inconvenienced? What medical analysis and diagnosis are they missing out on because of this closure?
On your question of how are patients being inconvenienced, if you take the cancer unit, the oncology unit, I know this is now opened again, and we are told by the MEC that it's a standalone building, and that's why they were able to repair and bring it online again. But these are patients who have been diagnosed already with cancer. You know, if all of us have had experience of family members, friends being diagnosed with cancer, and how weak that individual becomes, the pain that person suffers, the treatment that he or she has to receive. Now, when that means that the patient has to be transferred to another hospital, there's the inconvenience of transport, there's the inconvenience of pain and suffering, there's the inconvenience of files being lost. And we saw what happened with the Esidimeni issue that was screened on our televisions and our newspapers. When interruption takes place, it does actually cause a lot of pain and suffering.
So as the group of protesters will be making their way to Gate 6 today, what exactly are you hoping to get in terms of reaction from the health department?
We are hoping that we have asked for people to come to Gate 6 on Jubilee Road outside the hospital at 11 o'clock to show their concern about this hospital not being fully functional as yet. We have a number of speakers from Section 27, from the Dean of the Healthcare Sciences unit, some doctors from other hospitals will be talking, and of course they will be available to comment on what is going on in the hospital. So there'll be more factual information coming through as well. But we're hoping that the Premier in his speech tomorrow will give some prominence to what is happening at Charlotte Maxeke Hospital.
Very well. Thank you so much. Thank you for your time, Dr. Fazel Randera, speaking to us there about what the game plan is when it comes to defend our democracy. Dr. Fazel Randera hoping that comes 11 o'clock this morning that groups of people will gather outside to protest and make their voices heard, as the Charlotte Maxeke Hospital has been closed for up to 10 months now, and it doesn't seem to have an end in sight because they are now looking to extend that closure for another period. So we will be bringing you those developments outside that hospital throughout the course of this morning.